At 9 o'clock, call the meeting to order.
I have a request on the agenda. Can we move the discuss on letter for mainstays regarding IT up to with the other IT? Talk about it all at the same time?
One of the things the reason that this agenda is laid out the way it is because we have an 11 o'clock meeting. Mm-hmm. So the things that came in later that we could talk about at another meeting got put in the lodge. So that's why mainstay, if that is something that needed to be kicked to next week, I felt it could be kicked to next week.
Okay, that's fine.
Move to approve the agenda.
Second.
Any further discussion? All in favor?
Aye.
Aye.
Opposed? Motion carries. First, we have a resolution to adopt 2025 comprehensive plan. I know we voted on this 2 weeks ago. I asked if it could come back for the simple fact that this is the county's plan. The county has put $20,000 to $25,000 into this, and I think it deserves a vote of all three of us. I will read it, and then we will determine what we want to do moving forward. Whereas the Board of Supervisors and Planning and Zoning Commission recognize the need for a new comprehensive plan for the county, and whereas a steering committee was put together by Harrison County to aid in the completion of the comprehensive plan, including the solicitation of public input for the plan, and whereas public hearing was conducted by Planning and Zoning Commission to solicit public feedback, and whereas the Board of Supervisors was held a public hearing to provide the public a final chance to provide input to the comprehensive plan update. Now therefore, be it resolved, the Board of Supervisors for Harrison County, that the 2025 Harrison County Comprehensive Plan be accepted and approved.
The reason I voted no was because there was nothing in the comprehensive plan about the TCE. And Tony, we talked about that back when we tabled it before.
I support putting the TC in there, but I want it to go back before the comp board again. My concern on getting this passed is solar farms and wind generators.
But we can't do that till April anyway. The moratorium's through April.
Right, but this will have set us right for that. If you want to bring that TCE back as an amendment to this and how it fits in, I just don't have enough.
But will you commit? Will you guys commit to actually doing an amendment? So often things happen, things get said that they'll be done. And
No, I'll commit to reading it and see what it has to say.
That's where I'm at. I'll commit to reviewing it.
Yeah, absolutely.
And entertaining it, but I'm not gonna commit to a vote one way or the other.
Yeah.
There's a public hearing. For me to sit here and say, yes, I'm gonna do that, is telling the public, well, your voice doesn't matter.
as far as an amendment for the TCE.
Yes.
Okay. And because of this other thing that came up, I reviewed the future land use, and I reviewed the old map from the 2003. And the old map, the reason we have some of these, and I'm not sure why they didn't get changed, this is my understanding why some of these land use areas, like along Overton Avenue, is Logan's land use area. Well, that's where the bypass was gonna go. It was gonna go, down Overton Avenue a little ways and come out south of Logan.
Mm-hmm.
And so this land use map isn't necessarily, I'm not sure, I guess I was on that committee, but I wasn't at the meeting where we did the land use, why that red spot for Logan is down Overton Avenue still instead of somewhere else. So that's something, I guess, can we change this land use map?
I think if you
In
go
the
back to the
future?
comp plan system.
Right, it has to go
Goes
to
back
planning
to
and
the-
zoning board.
Yeah, back to the board.
Public hearings.
Yeah.
But we don't
It's
have to.
the same thing as another amendment.
Okay,
Yeah.
so can we change that too when we change, possibly,
We could look- we
possibly?
could
Yeah,
look-
I review that as well. I mean, there's another thing that sounds like we need to review, so.
Yeah, I think it just kind of mirrored this instead of,
Re-looking at it.
yeah. And that's a thing, I don't feel that we got our money's worth with this.
I would probably agree a little bit. It was kind of boilerplate to me, so.
Yeah.
Maybe that's how they do it. I don't know.
Well, the old one, I was looking over the
Yeah.
old one, and it was good.
Yeah.
And all these maps, we got a lot of maps.
I thought they might reference back to that and pull those over.
Well, we didn't get any of those,
Yeah.
yeah. So,
I'll move to approve the comprehensive plan, the 2025 comprehensive plan.
Resolution date numbering 2026-004.
I'll second.
Any further discussion? We'll do roll call. Rebecca?
No.
I'm a yes.
Yes.
Tony's a yes. Resolution passes. Next, we have presentation from Insurance Committee. Is that you, Morgan?
I've been waiting for this for months, Morgan. Megan. Morgan's right in front of me here.
No,
I
I'm
think
here
a
too.
lot of us have
She
been
wants
waiting
to
for
do
this
it,
for
so.
months.
The insurance committee met on Tuesday to go over the final presentation from Hub. So we'll start with health insurance, because that's the biggie. So we basically looked at two different plans. So we looked at our current plan with Walmart, and then the ISAC plan with Walmart. So, the one that says current at the top, that's the current plan. It just is the benefits
Okay.
outline of it. And then the one that says ISAC proposed plan design, that's the one, that's ISAC plan.
Okay.
Okay, so there's not a ton of differences. The major difference in the two plans is the deductible. So, we were originally presented with a POS and a PPO plan from ISAC, but the insurance committee decided to just offer a POS plan because of cost and the plan design are essentially the same. We didn't see the benefit in offering
POS,
two.
piece of, no. What's
Um,
that stand for?
point of service.
Point of service, okay.
So, again, the only major difference is the deductible. When we were looking at cost, though, the cost on the current Walmart plan, they came back at a 3% increase, which in a typical year would be a great. We would take that in a heartbeat.
It's a lot higher.
Yeah. But the ISAC plan, they did give us the 14% decrease by going with strictly a POS plan, not offering the PPO plan. We were able to reduce it even further. So the insurance committee agreed that, you know, that's the way to go.
So turn that into dollars. What are we looking at?
Yes.
So then you're looking at this as your premium. So your monthly county portion is on the far right-hand side.
This is the annual,
That's the monthly.
the monthly,
This county cost.
yes.
Yeah, that's the monthly. So currently, for a single plan, the county is paying about $908. So you're saving there. One of the other major differences with the ISAC plan is that they only offer a two-tier plan, so they offer single or employee plus. Currently, we offer single, employee child, employee spouse, and family. So that's a difference also. Your premium on your employee child and employee family will go up, or employee child and employee spouse will go up, but employee family would go down. So we're currently paying about $2,800 a month, and you can see there it would be dropping to what, 1,500. So that is ultimately what the insurance committee recommends, is that we do switch to the ISAC plan due to the savings to the majority of the employees. 19 employees will see increased premiums because they are on a employee spouse or employee child plan.
Would it be beneficial for them? What's the difference if they were to go from an employee spouse or employee child to,
It's about, well, it depends on the plan, but anywhere between $20 and $35 a month.
more?
So, with that being said, It's approximately, and these numbers are, the numbers I have are kind of hard because we do have 20 people on our plan who are not controlled by the board. They're like landfill, Cobra, EMA, those people, so you guys don't control their premiums, but they are included in these numbers. It's approximately a $280,000 savings to the county to go that direction. Overall, that includes everybody.
So what is included in this, just health?
That's
insurance?
just health insurance, yeah,
Okay.
that's just health insurance.
So-
We'll go to all the other ones.
So this one here, you're recommending is POS plan under the proposal here?
Mhm.
Okay.
What are the,
The additional ask of the insurance committee is that since we are reducing the premiums by increasing the deductible, is that you give more to the employees' HSA, since they're going to see the increase, where the county portion is seeing the decrease.
How
So you're
much are
saying
we
about
talking
$600 a month on a family plan, we're asking for the full difference.
600 to the HSA, is that what you?
For a single, we're asking for 500, and for a family,
So
we're
we're
asking
asking
for
that,
1,000.
knowing that we'll settle.
We're asking that because you're increasing it at the employee's cost, so the county can save money. The employee's getting stuck with a higher deductible. And if we're saving almost $300,000, we felt we could give $68,000 back to the employees.
so we're giving them how much more per month?
It's
1,000 divided by 12, or 500 divided by 12.
So you're giving them a total of $2,500 a year?
You're giving the singles 2,000 and employees, family 3,500.
For
You're giving them the
HSA.
whole deductible?
No, the deductible is 3,500 and 7,000. You're giving them approximately half. Because we're giving them, we asked for the amount that you're increasing their deductible by in order to save the money. Increasing the deductible reduced our premiums. So we reduced the county's portion by putting a higher deductible back on the employee.
You're raising it $83 a month for a family, from what you do now.
We're raising,
The
We would be
HSA
asking for an additional.
and $41 for a single.
So what's that do to that 280,000?
It reduces your total cost, and this includes all those 20 other people, so it's not quite accurate, 217,000 is your savings.
So we're still saving 217,000.
So it's about 60-some thousand?
Total for the year.
Okay.
so you're putting approximately $200 a month in their HSA?
83.
$83 more than what you were
$200
already
more.
giving them.
They already get 125, so
So
you're talking
$83
$200 a month.
Yeah.
But what does that do to people that don't take the insurance?
They don't take the insurance, so they don't have
Yeah.
to pay it.
They're
they
getting-
still remain
They're getting
$166.
$166.
They're not paying the insurance though.
And by
They
the
have their own
time,
insurance.
right, please let me finish. By the time you take the tax out of that money, you end up with, I figured it out, $130. So we're giving people to not take the insurance, we're only giving them $130. But we're increasing to end up giving people who do take the insurance $200 in their HSA. And if they don't use their insurance, that's $2,000 a year,
But it's, that HSA is only for medical uses.
right?
Yeah.
It is not for personal use. The
Right.
$166 that is given to employees when they don't take insurance, they can use that for personal
Is in lieu
expenses.
of insurance.
Right, and we don't file out, and we don't have to.
Most companies don't offer that.
Yeah.
You said that's extremely rare that we offer that.
It's
But
a
it's
very good
also-
bargain for us.
It is,
It's also rare that we give people half of their deductible.
it's actually not. I talked to
They
most
just say-
counties, and, majority of the counties on the ISAC plan actually buy down, and most of their deductibles were under $1,000.
But I'm talking in the private sector.
Both of my previous private employers actually
Yeah.
contributed to the max of the HSA.
But we're
because there
also
is
not a
federal
private
limit.
employer. We're a public entity.
So
And
we
most
don't
of the
have-
public entities that I talked to at ISAC this week, they all buy down and on this ISAC plan, they buy down and their premiums or their deductible is less than $1,000.
So
We chose not to go the buy down route.
I've got
Because it's
these
more
numbers,
expensive.
Megan. What about the things that aren't covered through the ISAC plan? What do those numbers look like?
Okay, so we move from insurance, from health insurance?
I mean, don't we have general,
Yeah, I was hoping we could just go one insurance at a time. We can move through all of them.
I think we have to look at the overall, don't we, to make a decision?
They're charged differently, aren't they?
Yeah, so dental,
What's the difference to our employee as far as the PPO versus the POS? You said that it's basically the same,
One's a broad network and one's a narrow network.
okay? But the POS pays 100% out of network anyway, so it's, I just,
That's why we.
Yeah,
that's why we
Yeah.
chose, that's why Hub recommended that one, because it's essentially, they're the same plan, but that one is cheaper, so that's why they recommend.
If you go out of network too, you still get the Blue Cross Blue Shield rates because you're going through Blue Cross Blue Shield of Nebraska or whatever, and whatever their reimbursement is, so it's.
so our employees aren't gonna have to be going and finding a new doctor.
No, that's why we chose to stay with that. So that's our current dental summary, this is the ISAC dental summary. And then here is the eligibility costs on the two different plans. So the plans are similar. We talked with both ISAC and Hub, both of them recommended that we stay with our current plan because it is cheaper and the employees are happy with it. And this is an employee paid benefit, this doesn't cost the county anything. So the committee recommended staying also, since it is an employee paid benefit. And the differences in the plan are minimal,
Which one's our current one?
The Delta one.
One says
well, they're
ISAC.
both done, yeah.
Are they both Delta?
One says ISAC at the top.
Yeah, but you're not, you don't recommend this one?
We don't recommend that one. We recommend the current plan.
Okay.
Employees are happy with it, and it is cheaper than the ISAC plan also.
And they pay the whole premium anyway, so that's. What does this one say?
They have
15?
slight differences in them, the plans do.
Okay.
So then we have vision. So that first one is the current plan, this is ISAC's two offerings. Then these are the cost offerings on both of those. Again, ISAC and Hub both recommended we stay with current, because the employees are happy and our plan is cheaper. The ISAC plan, the first option is 10% higher and the other one is 48% higher than our current plan, so. The committee recommends we stay with Meredith.
Is that a cost to the county?
No, this is an employee paid business.
But to stay with these, are we gonna have to, then we have to still pay Hub and Assured Partners?
We don't pay Assured Partners, it comes through ISAC.
Okay, but we are gonna have to pay Hub the 30-some thousand?
We have to remain they have to remain our broker, yes, to keep any benefits that we have with them.
Okay. So that savings comes out of the 217,000? If we pay Hub 36,000?
Yes, and we do have a Hub contract that we can, it's the next agenda item, we can discuss it. They came back at 31,000, and they would still offer all the same benefits that we have now. They would work with Assured Partners, so we would essentially have two brokers for health insurance, and they would still go out and get us quotes every year for everything else to make sure that we're getting the best pricing across everything.
So that's actually, we're already paying Hub 36,000, so if we're paying them 31,000, it actually doesn't come out of this savings because, I mean, we're still saving $217,000, we're actually saving $5,000 on their fee.
Yeah.
Okay.
If they're not our full-time broker on insurance, they are coming on health insurance. We asked Assured Partners and Hub to get us, life insurance quotes. So this is our current insurance, Lincoln Financial, and then the Mutual of Omaha is Hub's quote. These are the prices. They did get us other ones also, but the Mutual of Omaha is the most competitive.
This is 100%.
This is 100% county funded. This is a benefit that we offer to the employee. This portion is 100% county funded. So currently you pay $6.75 per month per employee through Lincoln Financial. Mutual of Omaha came in at $3 per month per employee. And NIS, which is Assured Partners' quote, came in at $4.75 a month. So Hub was confident in moving to Mutual of Omaha, and so was the insurance committee, and they guaranteed us 2 years at that rate. And so the insurance committee recommends we move to Mutual of Omaha, and it would save us a little over 50%.
I see it. Put that into a dollar amount.
5,200. It's on that sheet. Right there, yeah. So not a huge savings, but
A little bit.
a little bit. And then when we asked for that, also we asked them to match, to give us the voluntary term, which is the plan that the employee pays. There are slight changes in that plan, moving to mutual, but it is very, very similar. The insurance committee was fine with those also, and that's again in 100% employee paid. So, and it is also, so we were happy with that. That will be a decrease to employees. On top of that, we asked them to, John brought up that at his previous employer, he had short and long-term disability benefits that were beneficial, and a lot of our members thought that could be beneficial. So these would again be fully employee paid through Mutual of Omaha. So these are just numbers, they're not anything that the county would be responsible for, just an additional benefit that we would offer to employees. They do have a minimum sign-up percentage, so it would be pending enough employees sign up for it.
I'm glad you asked all of them presented by it on top.
I was looking at her stack of papers.
Yeah, how many trees we killed? Have to kill?
Now, both long-term and short-term are paid by employees?
These would be employee paid benefits. If they choose to take them, they could. So again, it's not a cost to the county, it's just letting you know that
Yeah.
the insurance committee recommends that we offer it as a benefit. And if enough employees sign up for it, one of them needs 10%, I think it is, one of them needs 25%. So I don't know if we'll get 25, but we're gonna offer it if you guys allow us to.
If we
Cost
don't
the
get
county,
enough,
I
we
think.
can always change the rate.
Yeah. They're paying for it, what they want to do.
Yeah.
It's just a benefit to them if they feel they need it. Any questions on the Mutual of Omaha recommendation? Okay. Next is Allstate benefits. So, we have Allstate through Hub for critical illness and accident. With switching to Assured Partners for health insurance, our employees get an accident policy paid on them. That's part of the premium. But we want to continue to offer the Allstate plan so that they can enroll spouse, child, and family through Hub. And then keep our critical illness plan also. I'll give you these. We currently have 20 people enrolled in the critical illness plan.
We really are gonna go through that whole staff, aren't we?
Yes.
Aren't you glad you asked for it all?
One of the major things that was the deciding factor in this, is that the critical illness plan is, their premiums are based off of the age when they signed up. So if we have somebody who signed up for a critical illness plan when they started in their thirties, they're paying approximately $9 a month. And if they are now in their forties or fifties, and we made them move, it would triple or quadruple their monthly premium, because they
I
would
take
have to
less risk.
re-enroll.
I take less risk the older I get.
Yeah, but
Critical
insurance
illness,
companies,
That's
no.
upside.
No, it's not accident, it's critical
Critical
illness. You're more likely to get sick the older you get. So we do recommend staying with Allstate through Hub for the critical illness and accident, continuing to offer those, but also offer the accident plan through Assured Partners.
And that is 100% employee.
Again, that's why we don't want to force employees to change, because it could potentially be a huge increase for them.
but that's it, this would be included in our broker fee.
Correct. And yeah, this is a no cost to the county option. So, okay.
So the accident policy that will be added to, because of, if we go through Assured Partners, that's a benefit that they didn't have before.
Right, it's a, I don't even remember, do you remember the amount? Is it 10,000?
It wasn't like a huge amount, but it wasn't a lot.
But it's employee only
Yeah,
coverage.
so there's no children. We have a lot of children and spouses on our accident plan right now, so.
This is, information about the, Mutual of Omaha voluntary life one. So this is just kind of what it will be offering, and then the costs associated with it. But again, this is an employee paid cost, not the county portion. So
And you
shows
guys,
that it's it's very comparable, a lot better than the plan we're on already. This is the short-term disability plan.
these are just other proposals that you don't recommend.
No, that's the Mutual of Omaha one that we do recommend, but this is just what the policy includes. We don't offer short-term disability, so I don't have anything to compare that to currently. We stopped offering that several years ago, and so. Same with this one, this is long-term disability.
This is all under mutual.
Yes.
And these are all employee.
These are all employee paid
Yeah.
portions.
A lot of money if they get signed up for all this.
Okay, this is the proposal from NIS. This is Hub's, or Assured Partners proposal for life insurance. It's just showing you that the $4.75 a month versus Hub's $3 a month. And then this is their supplemental dependent.
This is just under,
More information.
this isn't what you recommend.
We don't recommend this one, but if you want to look at it, we recommend the other one because it's cheaper to the county. Okay, any questions?
So you said only 19 people will see an increase of $20 to $35 a month.
Those are the number of people that are on an employee spouse or employee child plan currently.
So what's the decrease for the employee on the single?
The single people will see approximately a 55 cents per month increase, so.
Increase?
Yeah.
Oh, okay.
Yeah, we only looked at the substantial increases. I don't consider 55 cents substantial, but
A month.
those 19 people, yeah, it comes out to about.
So we're only increasing the HSA on those people.
No, we're asking for an increase on all because everybody's deductible is going up.
So you guys considered all these, you have your recommendations in there. Do you have a sheet of paper that lists all those recommendations for every item?
Like a summary.
No, because, no, I don't.
Okay.
We just met on Tuesday. and
Yeah,
Okay.
well, and there's just so many that I mean, we can just start health and work our way down. We can start with the easy ones, do health last.
I'm comfortable accepting the recommendations of the group.
Assured Partners has asked for an answer. They
Yeah.
wanted an answer this week so that they can.
Because I can see what you've chosen.
When we came in here thinking we were gonna see a 10% increase, and now we're looking at
Yeah,
a
and
14%
this-
decrease.
Well, so
And it looked, and you guys are satisfied, the committee is satisfied.
yeah, and one of the major concerns was we switched a couple of years ago and it was a horrible experience.
Yes, it was.
And then we switched again, and now we're asking to switch again, and the employees are a little bit,
Well, I'm sure they are.
yeah. And so
But they stay with Wellmark Blue Cross Blue Shield.
it is a new plan though, so they will have deductible rollover, they will have to get any new pre-authorizations, they'll still have to go with the whole, and it is a new plan, so,
They will have to,
yes, they have to go through, even though it's still Wellmark to Wellmark, they have to go through all of that stuff again.
the rollover and all that.
Yes, and that was a nightmare, but Hub was amazing with us, and that's why, again, we are asking to keep Hub on because they will work with us. And not that Assured Partners wouldn't, but Assured Partners has 39 other counties that they work for also. And when we call Hub, we get an answer ASAP, they are coming here, they will still do all of this stuff. We'll essentially have two brokers that we can lean on to have employees have that person to talk to.
2 brokers for the price of 1.
Essentially, yes.
And we
And a
pay,
substantial savings from what we were paying last year.
and we paid 90% of the premium.
Yes.
that correct?
That's, yes, that. And we
Employees-
paid that, or we changed that a couple years ago. Yeah.
I'm just not comfortable with increasing the HSA that much.
Why is that?
I
It's
just,
low based on my company.
because the $3,500 deductible, if they use their insurance, yeah, they need that extra money, but if they don't use their insurance, they don't need it.
If that doesn't go away,
So we're gonna increase it to $2,000 a year.
what,
In their HSA.
$600 increase?
It's a $500 for
$500
employees,
increase for employees.
an extra 1,000 for a family plan.
Okay.
We asked for the full increase of the deductible because one of the major factors that reduced our premiums was increasing the deductible. And since the employees are covering that portion and it's saving us so much money, we're asking that that be paid back to the employee.
And that costs us about $60,000, so it cuts our savings to about $217, is that what you said?
Correct, but then we had
You
a
have the extra
$5,000
$5,000
decrease
saving.
from
Mhm.
Hub, so we're
And
still
that's it.
saving $222,000.
And then we're saving $5,000 by switching to Mutual of Omaha.
So we're giving single people $500, you said,
Because
more?
that's how much their deductible's going up.
So,
A single plan.
A
You don't wanna
single
give
plan is
everybody
going-
1,000.
Yeah,
Yeah.
a single plan is going up from 3,000 to 3,500.
okay,
So we were asking for 500, and then a family is going from 6 to 7,000, so we were asking for 1,000.
I will make a motion to accept the committee's presentation as presented to us with the increases in the deductible and the savings in the premium.
Including the HSA.
Correct.
I'll second that.
Any further discussion? Call for a vote, all in favor?
Aye.
Opposed?
I,
Motion carries.
And so I will rerun these numbers and have the final budget numbers for you next week for insurance.
Do we still need to approve the HUD contract?
Yep, so that's the next, we have contracts with HUD, and they did give us a 3-year rate lock if we want it. I know last year you guys were against that, so they asked if we wanted it, we said sure, but, I don't think
Do you want me to go grab it?
are you guys even interested in looking at a 3-year rate lock, or do you just wanna look at a 1 year? And go from
I would
there?
say 1 year.
I'd look at either one and see if there's a,
So it's the same contract we have always had before, but since they're not our main broker for health insurance, they did reduce their costs. So, for the fiscal year 27, they're presenting an annual consulting fee of $31,000. And again, that does get split between everybody who pays, so landfill pays a portion, the assessor pays a portion, engineers pay a portion, and then the county, EMA, and then the county covers. We split it by the number of people on the
Sure.
plan at the time.
so are they locking us into the 31,000 or do they have a step?
No, it's a step. I think it's a, I don't look at pieces. I I said no, because you guys weren't interested.
Yeah, last year we just did,
You should have won your contract last year,
Yeah.
so.
and it's going down, so.
They are, I think if you talk to any employee who has had to work with them, they are exceptional at helping the employees. So it would, just like, that's the 3-year, fee schedule that we would be locking into. The bottom there, the 31 and the 31.
So then if next year we decided, it kind of is locking us in, if next year we decided to go with Hub, or with
So
ISAC.
it
for these
starts at
others.
31,000 this year, and then 31,932 next year. And final year, 2028, will be 32,892.
So, one of the biggest reasons that I was interested in keeping Hub is that they will go out every year and make sure we are getting, you know, this year, yeah, the ISAC plan was the most beneficial for us, but maybe next year something else would be more beneficial. We don't want to switch every year, but if we can save a substantial amount every year.
I'm pretty impressed that they said go somewhere else with the plan.
Yeah,
Yeah.
They're
they,
very supportive of
they
it.
are very supportive and they want the best for us, and we've worked with Hub for
Quite a few years.
yes, and they, Assured Partners is the broker for ISAC. They will never give us a quote for anything that is not ISAC, because they work for ISAC. Hub will give us a quote for any plan that we want to look at. So that was why we felt it was good, not only for the other benefits, but to make sure that every year we're getting the best quote possible. I'm fine with a 1-year contract. I don't.
Yeah, I didn't find one year.
Okay.
Okay. Go ahead and approve that then.
Take a motion to approve the 1-year contract with Hub.
Second.
Any further discussion? All in favor?
Aye.
Opposed? Motion carries. Now we have payout for gym rentals. Here's it.
Deputy.
Oh, that's right.
Last Saturday was his last day, so this is just his final payout.
See the tree guy?
No, sorry.
So
So
it
this
looks
is just
like
his final payout.
Okay.
179.5 hours of personal. And this is 50 hours of vacation. So the total is 8,943.60.
I'll move to approve the payout for James Reynolds for $8,943.61.
Second.
Any further discussion? All in favor?
Aye.
Aye.
Opposed? Motion carries.
The US Bank.
Now we have yours.
And you looked them all over, and I.
I did.
Make a motion to approve the handwritten warrant for US Bank for $16,357.04.
Second.
Any further discussion? All in favor?
Aye.
Opposed? Motion carries. IT interviews.
Okay, and this is, yeah, we have an applicant that we are, the guys have recommended we interview.
Okay.
Just openings next week. We've got a couple times, we ran the background check, it was good. Reference on timing or anything like that? Tuesday?
Tuesday's open for me.
What if we did Thursday after the regular meeting?
I've got SWIP code
Okay. Tuesday works for me.
Tuesday.
Tuesday? Okay. You guys free all day? I'll schedule.
For you, I can be.
I do have a preferred time.
I prefer in the morning, but
Okay.
does that work for you guys?
I'll talk with Joel and them.
Oh, yeah, because that might be hard for them, so I can be flexible.
Okay.
If they can't
Well, and
come
they
talk
might
to
be
you.
able to just, since it's only one, would you guys be comfortable if they were like on a Zoom or Teams call? Joel.
Oh,
Or
Joel.
Micah?
Yeah.
I'd like to talk to you a little bit ahead of time. And then, yeah.
And that's definitely fine, we can.
Okay.
I can
On the
send
phone, yeah, whatever.
Yeah.
Okay, I'll talk to Joel and Micah and see if we can get something scheduled for Tuesday.
Sarah, are you available? Yeah, Saturday.
Probably be court.
I'm in trial.
Okay.
Maybe check with Mitch to
See if Mr. Beer. Go ahead and close that door, please.
So
That's all.
if you want to do, if Joel's not available, I could do afternoon if you guys can.
I'll see what Joel and
I'm
Micah.
open all day.
And if we have Joel or Micah, are you good with that, or do you want both of them?
whatever.
Whatever's available, yeah.
Okay.
They both kind of spoke the same language.
Yeah. And I did talk to both of them at my schools, and they have some other stuff too that I think maybe you guys might be interested in.
Okay.
All right, now we have consider approval for Logan, Missouri Valley Country Club liquor license.
They're just renewing for it.
Make a motion to approve the Logan, Missouri Valley Country Club liquor license.
Second.
Any further discussion? All in favor?
Aye.
Aye. Opposed? Motion carries.
Move to approve the Willow Creek Banquet Hall liquor license.
Second.
Any further discussion?
Where is that at?
It's on
Willow Creek.
Willow Creek.
Is that the one out this way?
Yes,
White
on
Barn?
Wedding barn.
I call it the Missouri Valley shortcut, I don't know.
The Calhoun Road?
Yeah,
Or
Calhoun Road.
Over to Calhoun Road, okay.
All in favor?
Aye.
Aye.
Opposed?
Do they just come annually for that?
Okay. I'm with you, Michelle, I don't think it's the same, I think it's a different one.
That's not Willow Creek?
That one's
That's
Wishing Well.
Hill.
Wishing Hills, yeah.
Oh, that's right.
Alright.
Okay, make a motion to approve the liquor license for Callaway Falls.
Second.
Any further discussion? All in favor?
Aye.
Opposed?
I'm assuming the drain's been done and all.
Yeah, they're all good to
Okay.
go.
Oh, that's weird.
The DARE contract you
Okay,
sent
that's what
us.
I was waiting for.
Okay. This is what we talked about.
What's that?
Be safe for his bank account.
Okay.
Yeah, no, okay, so the opioid, committee met a couple weeks ago, and DARE requested the same, funds that they had the past 2 years for their scholarship program, so, the opioid committee has approved it. They're asking for $5,000 annually for 2 years.
Okay, go ahead.
Make a motion to approve the opioid contract for DARE.
Second.
Is there discussion? All in favor?
Aye.
Aye.
Opposed? Motion carries.
Woodbine Police Department, brought to the opioid committee to, send officers to a narcotics training, which they're at right now. And they were requesting that we send 3 officers from across the county. The opioid committee thought it was an excellent program and asked that we could send 5 officers. So they are they're right now, we have 2 sheriff's deputies and then 1 from each of the police departments. So they're asking for $5,000 total for 5 officers.
And that's all going through the law enforcement center.
It's the law enforcement agencies across, so you'll have Dunlap City, Woodbine City,
Okay,
Monroe
agency,
City, and
okay.
then Harrison County Sheriff's Department. So, and they did approve, the opioid committee approved that, so.
Move to approve the opioid contract with Harrison County Law Enforcement Agencies for $5,000.
Second.
Any further discussion? All in favor?
Aye.
Aye. Opposed? Motion carries. Bank reconciliations. Who wants to go first?
You're gonna ask today?
You want to see it, Tony?
No, only your name on it.
Yeah, you signed it.
Making sure it gets done. See that one?
Oh. You put your signature on it?
I'm waiting until that.
You're waiting?
What's that?
Not like when you set up, you should keep it.
Yeah, thanks for helping.
Yeah. Were those desks heavy?
They were not light.
I bet she'll think twice for you to answer
Oh,
making
man.
calls.
Well, I made his wife call him.
Yeah, I wasn't. No
You wanna
choice.
see this?
You can't tell me, you put yours in your front.
Thanks, I'll leave it. Anyone else before she?
I'm sick, so I'm on the agenda after this.
Oh, okay.
Last chance. All right, what do you got for us?
Okay, I have two abatements. City of Little Sioux did abandonments on two properties. This is the first one. They've already been awarded the property free and clear of any with the understanding, I believe, this is part of maybe the fire station expansion or something, I believe, is what this is about. So these will not go back on the tax roll because they're city owned. So, but they're in accordance with section 445.16, allows the county boards of supervisors to abate or compromise property taxes, interest, fees, or costs if the county holds the tax certificate of purchase, or if collecting the total amount due is determined to be impractical.
How much money are we talking?
So this particular property here is $967.
That's a really nice looking property.
It's a good one. So, got that. Sue, I don't know, do you want to do them separately? I have more than one.
This says you have two parcels,
Yeah.
508 Second Street, that's all we have on here.
Oh. Okay, this one I'll have to save, because this one was not, it's a big one, so we'll save it for another day. Okay, so, yeah, 508, they have like two things on that property. I don't understand. It's
Yeah.
two like decrepit looking
Buildings.
buildings,
Okay.
yeah.
Your recommendation that the county debates these?
I mean, you really have no, choice about it.
Really fantastic.
Nobody's been paying the taxes on this, the first one since 2012, so there's really, and the city doesn't have the funds to pay.
How much is it?
967.
Oh, that's,
967.
that was the total.
Yeah, that was that, no. The other one's more. So the second one,
But they're not, both at 508.
yes, they are.
Okay.
Oh, we can
Okay,
do
bring
that
it.
one, so, yeah.
Okay. So the other one is, the other parcel number that's also at that address. I don't know why it has the same address, but, 20,425.31.
Obviously hasn't been paid for years.
2011, or 2010, excuse me.
Is that including the Little Sioux's charges on there?
Their special assessments are in the amount of $1,381.77.
The rest is ours.
Well, it's not gonna get any smaller.
No, I just.
What's your recommendation?
You know, my recommendation is to abate them and move on. It cleans up our tax roll, and I don't have to keep track of these. I don't have the expense of mailing delinquent notices that are gonna come back to me. I don't have the expense of printing, tax statements that are gonna get mailed back to me, so.
It's been out there for years, someone could have taken it.
It's never gonna change, no matter what I do. I cannot get rid of any of the property in that county.
Sure, I think.
I'll move to abate the taxes on the properties, two parcels at 508 Second Street, Little Sioux.
Second.
Any discussion? I have some discussion. Is there anything we can say that this doesn't become private again? I don't want to see them get into a situation where they start funneling it through the city to turn around and sell it to private individuals free of this tax debt.
I don't think that's the intention of this property and this other one that I'll bring next week. I don't, because the city of Little Sioux did come to you guys some time ago
They did.
about wanting you to
Abate everything.
abate everything, which, I mean, This was their way of getting it abated, was to do the abandonment process.
Right, if they have plans for the city to use it and build a new fire station or whatever.
That's my
I'm fine with
understanding.
that, but I don't want them to say, we have this empty lot now, we're gonna sell it to the public because it's free of tax debt now.
Right,
Nobody's gonna buy it with this debt on it.
right. We do have some cities that have taken advantage of that, and after tax collection, I will be addressing it.
Okay, let's keep an eye on it.
Okay.
Call for a vote, all in favor?
Aye.
Aye.
Opposed? Motion carries. Next, we have discussion on legislation affecting public health.
I'll just go over this quickly. The Public Health Realignment, SF 2432. I emailed Jamie Cashman with ISAC and he gave me the following information. The second final deadline, which is this week, requires Senate files to be passed out of the House Standing Committee to remain eligible for this session. Accordingly, there's a subcommittee meeting on SF 2432 in the House tomorrow, which was actually yesterday. And if it advances, which it did, and gets passed out of the House Local Government Committee this week, it'll remain eligible for this session. The shortened version is now the bill after the Senate put a strike after amendment on it on the floor. I'm not sure what that is exactly. If no additional changes are made and the House passes it during further debate, the bill will move to the governor for final consideration. We hear your concerns, and attached are what we will be presenting to the House members tomorrow. This is what was attached from the Iowa County's Public Health Association, which is part of ISAC. So, let's see, the original bill was over 50 pages long and it has been reduced to just 2 pages. I had a meeting with CHI Health Missouri Valley Administrator Alex Burhoff, and we discussed the legislation and the possibility of us partnering together related to the legislation if it should pass. The position statement, among other things, says that the requirement to set up agreements with local hospital systems is problematic because of the uncertainty of their willingness and ability to take on the services outlined in a bill. So the bill passed out of subcommittee and will likely pass out of committee for consideration by the House. HHS has recommended an amendment that would soften the requirement to partner with local hospitals, but it's unclear if the amendment will go forward, so we're kind of in limbo on that one. The other one we were watching closely was House File 2712 and Senate File 2462, the Early Childhood Family Support System legislation that would replace the ECI boards with HHS contractors and ECFS advisory boards. HHS districts would replace the current ECI areas. Thriving Families Alliance held a legislative forum at the end of February on this. The legislation has moved out of committee in both the Iowa House and Senate. Amendments have been made to the bill, but our funding for Learning for Life would still be handled by HHS and the new district contractors as it stands. In the House, consideration for the bill has been moved to appropriations, which makes it eligible for consideration until the end of the legislative session. I think they were doing that so it would get full consideration and maybe not just be pushed through, but anyway, that we receive $180,000 for our Learning for Life program, and that would be moved to the new contractor, and it would be unclear if we would then be able to be a subcontractor.
Basically the same thing you did with mental health. They hand it all off to a contractor, all the mental health care.
There's
Yeah.
a lot of pushback on that. At ISAC last
I hope
week,
so.
they had some mental health folks come in and talk. And those 2 poor ladies that were presenting got beat up by
I
them.
felt bad for them,
I
but,
did too.
because it's not them directly, but they took the heat from the sub-supervisors.
So hopefully they listen. I know we had that meeting.
Yeah, it was a
2
really
weeks ago.
good meeting.
The representatives that were in attendance seemed very open to listening and supportive.
The problem is, the reason the supervisors were frustrated was because they said that they're not access to this new system and access to what they need. They don't, it's hard to get, it's not easy to access. And so that's why counties are frustrated.
Yeah, there's, the mental health was just the one contractor, I believe.
One the
Iowa
state.
primary care.
Yeah, the one contractor for all 7 districts. That's what we're concerned about, that even with the disability services, they just went with 4 contractors. So we may have a contractor that covers all of like western Iowa that we're dealing with, from southern border to the northern tip. So, and our parent educators have lots of experience and relationships that could be lost if the program is taken over. The state has kind of argued that some of the programs weren't evidence-based, and at least the ones that Thriving Families Alliance manages in southwest Iowa are with an approved evidence-based program. The parents as teachers were an affiliate and have that certification. So anyway, yeah, we're monitoring that and keep you updated.
Thank you for everything you're doing with it.
Yeah.
Keeping us informed.
Thanks.
So, 4 minutes, the mainstay, the letter. Did you read that, Tony?
Yes. Yeah.
I just was wondering if we can, I don't know if we wanna, obviously not today, but if we're gonna meet on Tuesday, could we meet and do like a conference phone call with him? Just,
I'm not in favor of the 2 to 3 days. I think we need a full-time person.
I do. I think it'd be wasting their time.
my concern is, we're having an IT person we're gonna have one IT person. They're gonna be having one person 24/7, 365. Like, what if they go on vacation, or, you know, they have to answer their phone.
Well, just like Micah told us, they share,
Counties.
counties share between themselves. So if he's going out here, the Monona County one will pick it up. Shelby, whoever's around.
My concern with that is, you don't get to schedule when you have an issue.
Right, you
You
call.
don't say it's on Tuesdays and Thursdays. We always have problems on Tuesdays and Thursdays. IT problems pop up all the time.
Right, and I'm not saying I'm against, full-time, I just was wondering if we could at least let him talk to us.
You know, I've talked to Solutions, I've talked to I kind of understand how that works. I don't think that's what we want. I think we want somebody on site. We want to control all the purchases locally, yeah.
I don't even think it's a want, I think
It's a need. Yeah, I agree.
You don't wanna talk to him?
I don't.
I don't. All right, we got through everything. We got 3 minutes before we open public hearing.
You know, move that to next week then? What we didn't cover.
You skipped.
I skip.
Discussion of future roles of conservation and public health.
Oh,
board members.
no, let's get it out.
Okay.
Okay.
Sorry, I seen public health and this.
Okay, jump right over.
I'm opposed to it. Where you guys are at.
Where are you at?
I'm willing to work with whatever you guys want.
Okay. That's kind of where I'm at.
We talked a little bit about this at our Board of Health meeting. We just have one opening next year, and it's Dr. Alvis, and we need to keep a medical professional on our board. He's the one who signs our standing orders. We also have Christy Jackson, but Dr. Alvis is the one who's been signing our orders, so next year it would be hard to do that for us. But
I think it's something that we can discuss when we,
I agree.
all right.
Perfect timing.
I no faith in you guys getting too old.
I know, I'm kind of impressed, Brian. You did a good job. And once you get everybody in, if you close the door back there, it'd be great.
I don't think you're gonna be able to.
And if you can't, you can't. I guess all the noise was everybody out there before, so they're all in here now.
All right, 10 o'clock, I'll open the public hearing.
Couple agenda items. First on the agenda was a rezoning from A1 to R1 for Donald Denning. He's selling some property to his son to build a house. It's about 8 acres. There's no comments from any other adjoining landowners. The next agenda item, rezoning of approximately 2.5 acres from A1 to B1 business district. And recommendation of the zoning commission is to deny that zoning map amendment. So that's that.
And that was unanimous.
Correct.
On both.
Okay. All right. I'll move to approve the first.
Hold on.
We're
still in public
Still in
hearing.
public hearing, you're right, I'm sorry.
So,
I'm sorry.
this is your guys' chance, there's no time limit, I will ask you to be respectful of other people's opinions. Try and maintain order. Who wants to go first? I know everybody has something to say. Yes,
Yeah.
sir.
Good morning. I'm the bad guy in the room today, so I thought I should go first. My name is Nick Ryle. I am an attorney with Whitfield Nettie Law Firm, and I represent the Overland Group who's developing this site, which is intended to be a Dollar General. That's the second one that got denied. I want to briefly reiterate comments made to the Planning and Zoning Commission just to bring you up to speed as to the Overland Group perspective and why the rezoning should be approved. So the site is currently classified as A1, wishing to be rezoned into B1 Business District. And as the board is aware, the ordinance for A1 encourages development in A1 areas where services are provided or can efficiently be provided. So we check the boxes in those regards. First, because the site is just south of Logan, so it would sufficient economic support for the business does exist. But the services can also be provided efficiently, and that's considering a few different things, including water, sewer, access, and addressing floodplain concerns. So taking those one step at a time, water, initially Overland planned to annex into Logan to gain water access, but Overland now plans to develop in Harrison County, so that would avoid any need for annexation. 2, as to sewer, Overland plans to install a septic system, and that will be minimum use, single or similar to a single family home, approximately 1 to 200 gallons per day. There was concern by many residents that the public or Planning and Zoning Commission has to traffic concerns. Overland's been actively discussing traffic concerns with the Iowa DOT. There's an ongoing traffic study. So Overland is working very closely with the Iowa DOT for the proposed driveway location, and final details will be determined after that time. There was a question by the commission as to access for semis. I'm not a CDL holder, but doing some quick research, it looks like from a 2-lane road, a semi needs at least about 30 feet to gain access, and this proposed site plan has 36. So there will be sufficient access for that as well. And then finally, this particular site is on a floodplain, so fill will be required, but Overland is very aware of this and has already started the floodplain permit process with Iowa DNR. So collectively, this rezoning will not substantially alter the surrounding area. The development will comply with all zoning and ordinance requirements, and the ordinance, or pardon me, and the rezoning will have sufficient economic support as well. So really, when we're looking at the criteria that the board is looking at, we're checking all the boxes here, and for these reasons, we would encourage the board to approve the rezoning from A1 to B1. Appreciate it. Thank you.
Hi everybody, my name is Matt Gross. I'm the current Chamber of Commerce president for our Logan businesses. I had Brian give you all a small packet. There's a letter from our chamber. I think you all have had the opportunity to see the letter prior to the meeting. But then there are also over 70 signatures from our local business owners and business stakeholders within the community that agree with that letter. So I am not speaking for myself. I'm speaking on behalf of our local businesses. There is also, I'll get to that in a second. But anyways, so the first thing I wanted to bring up was the fact that having a Dollar General in this community will negatively affect our current local retail economy. I do understand that that is not an item that you can that you can make a decision based off of today. But I did want to reiterate that and let you know that that is a significant concern for our local business owners. That will trickle down throughout the community. As many of us know, our local businesses support countless nonprofit youth organizations within the community. When we have post-prom kids or a local baseball team or our nonprofit foundations who are looking for donations, they come to our local businesses and request those donations. To be very honest, the donations will probably be the first thing cut from our budgets if the sales and the profits are not there. So please take I know you can't officially take that into consideration, but please keep that in the back of your mind. The next item is, of course, the comprehensive plan. We have recently passed and adopted the 2025 plan. A question for you guys, how much did that comprehensive plan cost the county?
Between $20,000 and $25,000.
$25,000. Okay. So we're going to put this, we developed this plan, approved this plan. Honestly, if we're not going to follow the plan, why are we spending $25,000 to do that? So I encourage you to, I think that denying the request for rezoning based on that alone is sufficient. The next thing that I wanted to discuss with you guys is the traffic safety issue that comes into play. I have full faith that the individuals representing Dollar General will follow the laws or the guidelines by the DOT. They'll follow the minimum guidelines, the bare minimum guidelines to say that it's safe. Okay, I have a little bit of information for you, some pulled from the Iowa DOT as well as our local fire department. The DOT from the Hog Creek Bridge, which is just, very close to like the Religious Arts, Calvary Falls. So from the Hog Creek Bridge to the Harrison County landfill, and this is the last 10 years, there have been over 70 accidents in that 2-ish mile stretch of Highway 30. 70 in 10 years. I would say that is a significant number that should be thought about. I don't think it's the most important number that you guys should, that I encourage you guys to think about. The most relevant number that I think is worth talking about is a number that I requested from the Logan Volunteer Fire Department chief. The chief and his group, as well as the county, other county fire departments, one thing that they do every May is they put out white crosses that represent a fatality on our roadways. In that very same stretch, and I understand that this is historical data, it is not 10 years, I do not know how far this goes back, but in that same stretch of road from Hog Creek to the Harrison County landfill, about 2 miles, there are 27 crosses that get put up on that 2-mile stretch. 27. In researching just through the DOT, one of the main causes of accidents on our highways is intersections and driveways. We're talking about putting in another driveway on a historically dangerous stretch of road. So I don't think that it's a question of if, I think it's a question of when there would be an accident in front of this potential Dollar General. And I think the only if that you guys should consider is if there'll be another white cross that's put up right in front of there. So please take all that into consideration. I would be happy to answer any questions if you guys have any. And I'll go ahead and take a seat. I urge you to not approve the rezoning on behalf of the Logan Chamber. Thanks,
Right. I'm gonna stick to the script. Sorry, I'm not as good at ad-libbing as Matt is. Good morning, thanks for having us today, we appreciate it. My name is Bruce Niedermeyer, I'm a Logan resident. I'm also a licensed landscape architect and urban designer. I serve on Logan's Planning and Zoning Commission, and I'm deeply involved with just shaping the future of the community with a number of other folks in the room. I grew up on a small family farm north of Magnolia, and understand how important agriculture is to this county. It's part of why I chose to move back here 9 years ago with my family and raise them here, and I believe deeply in the future of Logan and Harrison County and in protecting what makes this place unique. In my professional work, I collaborate directly with people who lead comprehensive planning efforts across the Midwest. I also led Logan through the Iowa's Living Roadways Community Visioning Program in 2022, which established a vision for our community. I can say from experience, these plans are not taken lightly, as you know, and they are built on public input, technical expertise, and a shared vision for the future. Because of that, I think they should be respected. The Harrison County Comp Plan is very clear. It identifies agriculture as a cornerstone of the county's economy and calls for the protection of agricultural land. It also states that agricultural zoning is specifically intended to prevent encroachment from commercial development. This rezoning proposal is exactly that encroachment. The plan also directs growth into the core of existing communities, like Logan, and emphasizes preserving rural character. The proposal does the opposite. It pushes commercial development into agricultural land and opens the door for more of the same. And I would say once that door is open, it's going to be very hard to close. I would also point out that this site is impacted by the floodplain, which we've discussed. The comp plan identifies flood-prone areas as constraints to development and less suitable for new growth. Moving forward here would require altering the land itself, as we've heard, which raises additional concerns for further conflicts with the plan. At the end of the day, this comes down to consistency. If we ignore the comp plan right now, it's not a plan, it's just a bunch of suggestions. And that undermines the time, effort, and especially the public trust that was put into developing it. From my professional planning and design experience, I can say this plans only work if we follow them. So I also want to note that, briefly, that the proposed use is of course Dollar General, we know this. I don't believe the county needs a Dollar General, and I don't believe changing the land use policy for this type of company whose business model has been shown to prey on low and fixed income households, has faced repeated allegations of overcharging customers, and has drawn scrutiny over store safety and staffing practices, all while continuing to return significant cash to shareholders rather than investing in our rural communities. That's not the kind of business that justifies overturning the comp plan. For those reasons, I would strongly urge you to go with the Planning and Zoning's recommendation to deny this application. Thank you.
Good morning, I'm Tammy Hinkle. Sorry, do you have any questions?
Is it possible that you should go back and forth if there's anybody that's?
Whoever wants to speak.
Yeah, whoever wants to speak.
It's nice to meet you, Nancy.
Yes, nice to meet you. I'm a Logan citizen, and I co-chaired the Community Vision Program with Bruce back in 2022 when Logan was selected for that through the Iowa Living Roadways Program through the state and through Iowa State Agricultural Landscape Program. And then I am a board member on our community foundation, and there are several of us that are a part of that group, and of course just moving Logan forward. Thank you for having us here today and for the opportunity to speak. My primary concern with the request to rezone part of the Wester Estate from ag to business is that the land is not designated, as Matt and Bruce both brought up, for commercial use in either the current zoning plan or of course the newly approved plan, which you both all did this morning. A significant time and money went into creating the plan, and I believe it's essential that we respect the recommendations of both the plan itself and our zoning commission. I'm also concerned about the safety on Highway 30. Adding another turn in a 55-mile-per-hour zone on an already dangerous stretch of road increases the risk for everyone who drives it. And we all know that Dollar General has surveyed the property, and they're planning to build a store there if it is rezoned. And the economic and community impacts of that are substantial. While the store may offer convenience, it threatens the stability of our local businesses, leads to loss of economic circulation, and raises a major red flag for long-term development. Number one, the impact of local businesses. We have almost all of them in the room, I think. EV Drug, Country Hardware, She Market, One Farm Market, Superfoods, and several more, but I think those are the ones that are going to be affected the most. They are the heart of our local economy. These businesses will struggle to compete with Dollar General's aggressive low-price model. Losing even one or two of these key retailers would disrupt the delicate economics ecosystem that keeps our small town thriving. Number two, the loss of local economic circulation. Money spent at locally owned businesses stays in Logan. everybody that has already spoke to this, but it recirculates through wages, local purchasing, charitable giving, and community fundraising. Dollar General, on the other hand, sends its profits to corporate headquarters rather than reinvesting locally, and they typically only employ a small number of part-time workers, often at low wages with minimal, if any, benefits. That is not the type of employer that we want to have here in our small town. Number 3, long-term development concerns. This is where it is most near and dear to my heart. Over the last decade, Logan has made remarkable progress economically, socially, and culturally. Our downtown business district is thriving through initiatives like the Community Vision Program and the work of our local community foundation. We have built momentum toward a stronger and much more vibrant quality of life. Placing a Dollar General on the outskirts of town does not align with the vision of our community that we have worked hard to create, and it does not support our long-term goals, our identity, or the direction in which Logan is growing. If development is the goal, I'm confident we could work together to bring in something that adds far more value to the community as a whole. And finally, we put a petition together over the last week over our social media, but then also over the last couple of months, just personal conversations. But we have over 300 signatures from folks in the county. And about a third of those are from Logan residents and mailing addresses, but we also have people that are speaking up from Missouri Valley and Woodbine and Magnolia, Persia, Pisgah. We don't need one more Dollar General in our county. We can drive 10 miles each direction and go to get lower cost items if that's really what we need. Several of us work in Omaha or Council Bluffs, and we're there and can pick up something that's not provided at Logan if that's what we need. It's not how we want our town to move forward. It's not what we're looking for when it comes to growth. Thank you.
I know there's more comments, my phone's been ringing.
I have a comment. Michelle Sturz. I'm opposed for this, for both the town, the businesses within the towns, and then also the land. I'm opposed that we would take some agricultural land and make it as a business that would be outside the business areas. So that's my comment.
I will just say that my name is Carrie Busing. Sorry, I'm Carrie Busing. I own a few businesses on Main Street, and I would like to speak a little bit about the usage of the highway and the semis that would go into Dollar General. So I own the dance studio here in town. I also own a dance studio on the Nebraska side, and recently they built a Dollar General outside of the town that I have a dance studio in. And always, at least twice a week, which is when I teach dance there are semis on the highway for Dollar General that are backing up traffic, and people are trying to pass them to go around. There have been 2 recorded accidents. You can also see this in Woodbine. We heard from someone before that if you are driving to Woodbine, you can see the same thing happen. There's a pileup of cars. While they say that there is so many feet for them to get in and around, the question was proposed, can they go around the building? And the answer to that was no. We all know that not all CDL carriers are created equal, and parking can sometimes be an issue. So with that stretch of road already being a very dangerous highway, and you can see it from town to town that you go to, cars being backed up due to Dollar General trucks, I would say that that is a huge concern. Also, just as a business owner within this town, I use resources all of the time, like our local fresh food market, our grocery store, our pharmacy. And I'm grateful that those places are open because it allows me to conduct my business here within this town. I do not have to go to an outside town to get what I need, which allows me to provide services to our community more consistently. So if we bring in a Dollar General and it does affect those profits at a grocery store or a pharmacy or a hardware store or any business in our community, it will also directly affect businesses like our bakery and our tap room, because we utilize those services to get supplies that we need and just to get things for our family that are right here within our community. So having those go away would be a huge detriment to just how we conduct our day-to-day business. So thank you.
Anything else?
Take care.
I'm so sorry, I'm getting off and I wrote myself this email.
Anybody else want to speak?
There's one of them.
Got one finding her note.
Okay.
Sorry, no.
You're okay.
I had it pulled up.
Don't worry about it.
I can go. Danielle Richter, I own the market here in Logan. And I just want to mention that I did research what your roles and responsibilities are as supervisors, and so I just want to kind of mention that all here to everyone, and that to me, it appears that your first role, and you can correct me if I'm wrong, is the general welfare and the health and the safety of our community, and that's kind of first and foremost. And so I think there's a lot of reasons why the health, the welfare, and the safety of our community will definitely be impacted should this move forward. And the second piece being that the comprehensive plan is what is your guiding light, and this does not include this in your current plan that was just approved this morning. And so I just want to urge you to think about what your role and responsibility is based upon your duties to our citizens, and just keeping that kind of first and foremost when you're making this decision.
Thank you. And both comp plans are the same on this, correct?
Correct.
We did not change anything with the comp plan regarding this.
I'm so sorry. I threw out my back and I'm on meds. I'm so sorry. Hi, y'all. My name is Missy Rowe. I have had a couple businesses here in the county over the past 8 years that I've lived here. And there are a ton of familiar faces in this room that supported me. And I want you to know that before I read this, I am also here to support you. And it's never ended. So I want you to know that. I want to start by saying clearly, this is a conversation is not about being for or against anyone or any store. It's about being intentional with the future we are building. Because whether we like it or not, every decision we make right now is shaping what Logan and Harrison County as a whole looks like 10, 15, and 20 years from now. We are not separate from each other. Logan does not exist without Harrison County, and Harrison County does not thrive without strong communities like Logan. So the question isn't, is this store good or bad? The real question is, what kind of community are we choosing to become? There's a lot of information circulating about dollar stores. Some of it is accurate, some of it is exaggerated. Yes, in some communities, they've filled gaps, but in many rural towns across America, studies have shown a pattern. They don't just compete, they often displace small businesses. Local grocers struggle, Main Street traffic declines, and over time, the convenience we thought we were gaining can quietly erode the very character of the town. That doesn't happen overnight, it happens slowly, and then all at once. And here's the part I think that matters. We're not a town in crisis. We're not a food desert, and we're not a dead Main Street. We are not without resources. We still have something incredibly valuable and a foundation worth protecting and building on. And once that foundation is chipped away, it is very hard to rebuild. I also want to acknowledge something very important because I hear it and it matters. Families are stretched right now. People are doing what they need to get by, doing what they need to do to get by. Convenience and affordability matters. That is real and it deserves respect. But long-term growth requires us to look beyond just immediate convenience and ask what actually strengthens our local community over time. Because cheap in the short term can become very expensive for a community in the long term. So when we talk about a 20-year plan, we should be talking about a 20-year plan. What we need to ask, do we need a community that is driven by outside corporations that extract dollars and move on? Or do we want a community that invests in itself, supports local businesses, and builds something sustainable, and creates a place that kids are actually want to stay or come back to? Which recently mine have. The one that y'all helped save her life. And I'm grateful, very grateful. Do you want a community? I'm so sorry, we've gone back there. Because this isn't just about today, it's about what our Main Street looks like in 10 years, whether small businesses can survive here, and whether we grow with intention or by default. I'm not here to shut anything down. I'm here to say we need it to be thoughtful, informed, and proactive. If we're going to grow, let's grow on purpose. Let's make decisions that align with a vision, not just react to what's put in front of us. Because the future of Logan and Harrison County is not something that just happens to us, it's something we choose. Thank you.
Thank you.
Anything else?
I think we're nearing the end of public comment. So just as your attorney, I find it prudent to remind everyone that there's a prohibition against making determinations against the individual. Considering whether or not that it is Dollar General that is going to move into Logan is not necessarily allowed, and it's not a statutory factor. And what we're really looking at is the statutory factors that were considered by the zoning commission. And the commission took a long time looking over them. They looked at the comprehensive plan. That is first and foremost. What does your comprehensive plan envision for your land use? Second, you look at Iowa code. Iowa code has strict advisories to preserve agriculture. It is within the code that you do not want to utilize agricultural land for commercial land, especially if it is creating a commercial island. So they're also looking at how close is this rezoning to your industrial district. They're also looking at the infrastructure, the water, the sewer, the traffic. That was something that they considered as well. And really just a development pattern analysis. So I just want to emphasize to the citizens of Harrison County that the determination was certainly not based on what commercial entity was coming in. It was based on those code factors. And so it was a very neutral and detached determination that you folks have coming from the zoning board to you. And I would caution you to consider the identity of the entity that's moving in when making a determination today whether you want to rezone from commercial or from agriculture to commercial. So those are my guidelines that I would give all three of you folks.
Anyone else want to speak?
I'll just say something quick. I'm Danelle Meyer, owner of One Farm and formerly One Farm Market. The Southwest Iowa Local Food Summit was held in Logan in November, and although I wasn't there myself, the reason it was held here is because so much has been happening on Main Street in Logan, and people were coming here to say, how are you doing what you're doing? And I just want to throw that out there as a fact that like people are watching us and people are seeing our achievement on Main Street, and so it doesn't matter who, it doesn't matter this Dollar General, but just it asks a question of like, what type of development do we want to have happening in Logan? So I just want to share that.
I believe I introduced myself already, Carrie Beasing once again. Not considering who is going into what property, it has been identified that one of the massive things that we are missing here are homes for families that are coming in. And I can think of a lot of other entities that could go into that area that would benefit our community, such as homes for future families that would move here. That would also help to alleviate any traffic concerns, as there could be multiple points of entry and not just entry from a highway. So that could also be taken into consideration.
Anyone else?
I second that.
If not, I would entertain a motion to close the public hearing.
Motion to close the public hearing.
Second.
Any further discussion? All in favor?
Aye.
Aye. Opposed? Motion carries. All right, let's vote on the Donald Denning first.
I move to approve the Donald Denning change from A1 to R1.
Second.
Any further discussion? All in favor?
Aye.
Aye. Opposed? Motion carries. And now the West Side.
I'll move to follow the Planning and Zoning Commission's recommendation and deny the motion to rezone from A1 to B1.
I'll second. Any discussion?
Yeah, I would like to read my statement. Economic growth and development in our county, and I'm like her, I'm gonna read it, so I stay on track. The community has made significant strides promoting economic growth and development. One notable action has been zoning a piece of land commercial to accommodate a data mining center. Additionally, ground has been zoned construction for a natural fertilizer plant or commercial. There is also a gymnastics facility located between Magnolia and Logan, that in an area that was not included in the comprehensive plan for development. Midwest Mechanical is situated across the field from the proposed site. It's already zoned to commercial. We need growth and business diversity, recognizing that every issue has multiple perspectives. Growth is essential for the county to avoid stagnation. A diverse array of businesses is necessary to serve the needs of the local community, while also attracting visitors traveling through the town along Highway 30. Many residents are unable to travel to Woodbine or Missouri Valley. I've gotten a number of calls and messages from people that say they don't want to have to travel to Woodbine and Missouri Valley. They would greatly benefit from having essential services available in Logan. Currently, there are gaps in local retail. How many of you bought your socks and underwear in Logan? Wrapping papers and toys. Furthermore, small businesses are not open late, limiting access to last-minute necessities like greeting cards, convenience, foods items. For those who work in the city, having a Dollar General on the route home would be a valuable resource. Many community members already travel to neighboring towns for these stores, and a local Dollar General would provide job opportunities for residents seeking employment close to home.
We're not
Balancing-
running on Dollar General.
Right, exactly, that's what I'm getting to now. Balancing community interest and their property rights, this is what I'm basing my decision on. As your county supervisor, my responsibility extends to representing the interests of the entire county, not just those present at this meeting. It's essential that we strike a balance between what serves the overall community and the rights of the individual property owners. It's crucial as we evaluate initiatives and development proposals that our county's future. It's also important to consider the benefits of expanding the county's tax base. By increasing the tax base through thoughtful growth and development, we can help distribute the financial responsibility more evenly and potentially reduce the tax burden on all residents. This approach ensures that our actions support both the prosperity of our community and the protection of property owner rights. And I took an oath to uphold the Constitution of the United States and the Code of Iowa when I took this job.
We all did, and we all took an oath to represent the people of Harrison County.
That's right.
The people of Harrison County have determined what they wanted in the comp plan. That is as grassroots as it gets. There's public input, there's public meetings. These folks and everybody in this county say, this is what we want for the county. And that's what we're voting on. We're voting for what they want, not for what you want, what they want.
No, that's not what I want. The people, there is a lot of people that aren't here. And.
Where are they?
I'm gonna call for a vote.
Yeah.
We have a motion and a second to accept the zoning board's recommendation to deny the rezoning. All in favor? Aye. Opposed?
Aye.
Motion carries. Let's, do we have public comment on there?
Good job, guys.
Hey, folks. Excuse me.
We're still in meeting.
Excuse me.
Yeah.
Just see if anybody on that is already spoken.
Did anybody that's in here still want to speak in public comment?
Nope, good job.
Wait.
Oh, we have minutes. What all
Brad, let Brad.
If Brad has a public comment.
I have a comment, but let clear all the room or whatever.
There's another public comment.
Oh, back, okay.
All right, so let's, Megan wants minutes.
We can do public comment next person.
Let's do the minutes before we forget.
Make a motion for the minutes from March 11th.
This was the drainage meeting with Kate Bremer.
Second.
Back in the attended.
Oh, I shouldn't. Go ahead, you make the motion.
I made the motion.
I'll second. Any further discussion? All in favor?
Aye.
Aye. Opposed? Motion carried. Now we have March 11th, the ISAC legislative reception.
You can do all the ISACs at once, the 11th, 12th, and 13th.
Yes, so
I make a motion to approve the minutes from ISAC March 11th, March 12th, and March 13th.
I will second. All in favor?
Aye.
Aye. Opposed?
Abstain.
And then we have March 17th, the Farm Bureau meeting.
Oh, okay, make a motion to accept the minutes from the Farm Bureau meeting on March 17th.
Second.
All in favor? Aye. Opposed? Motion carries.
Did you do March 5th?
Yeah, where did those go?
Thought you had,
I just handed them to Tony.
I had them to you.
I had them here the whole time.
Make sure I don't have them. Oh, here it is, resolution one?
Yeah, that was.
Okay.
Can I see that?
Yeah,
That was the one Tony was gone.
Yeah, I wasn't here.
It was that really quick meeting when you guys had the funeral. And I'm pretty sure you sent it to me, I read it, and I just want to double check. Okay, make a motion to approve the minutes from March 5th.
I'll second.
Oh, I'm sorry.
You weren't here, Tony?
All in favor? Aye. Opposed? Motion carries.
Abstain. Don't take vacation. That's what's.
No fun for you.
Yeah.
The board will now allow up to 30 minutes for comments from the public. The board will call speakers in order in which they have signed up on the form provided. Each speaker is limited to no more than 3 minutes for speaking and must first state his or her name for the record. Comments should be directed to the board as a whole and should refrain from personal attacks or from addressing individual employees or citizens. Comments should also be limited to one topic. Detailed information about the public comment policy is available upon request. First, we have Brad Doyle.
Good morning, Brad Doyle. When I first started attending these meetings, I did ask the chair the question, are these meetings under Robert's Rules of Order? And as I recall, the answer was yes. Is that
We don't officially accept Robert's Rule of Order, but that's kind of the framework.
so you acknowledge that you do use the framework of Robert's Rules of Order?
Not officially, but yes, I try and.
Okay.
We'll try.
So, under Rules and Procedures, under Home Rule Authority 331-301 and 21.7, each board may adopt its own rules of procedure, rules of decorum, and parliamentary guidelines. Many recognized parliamentary procedures, such as Robert's Rules of Order, when not otherwise specified. These must be reasonable and uniformly applied. Where is your order or procedure specified? Because further it says that it should be basically on your county website for review.
That's not a requirement. Consistency, reasonableness, that's a requirement.
Alternative forms of county government 331.238 may vary some procedures but must comply with Chapter 21.
For public.
And so, Mike, the reason I'm asking this question, you guys approved the comprehensive plan this morning. At the last meeting, the comprehensive plan died. You then adjourned the meeting. Under Robert's Rules of Order, it was dead. And the only person, I'm sorry, it's my 3 minutes, Madam County Attorney. Under Robert's Rules of Order, the only person that can recall it is the person that voted in its affirmative. In this case, I would say it was Supervisor Wilkerson because she voted no and you voted yes. Then it must be recalled during that section, which again, you adjourn the meeting. So if you're going to run alternative forms of meeting rules, it would be nice if you could post that so that the general public has an idea of how things are done in the county. Thank you.
Next, we have Michelle Stearns.
Michelle Sturts, Missouri Valley. I just wanted to say thank you for the room design. It was just so much nicer. You know, we've wanted this for quite some time, and it was a nice surprise coming in today. I thought for sure Brian was sitting in the wrong seat when I first saw him, but then I realized that it was redesigned. And so it was so nice that you had so many people here today that people were able to fit. So I just want to say thank you to whoever.
We have to give credit to Megan who did it on her own.
I will give credit to the sheriff's office and the engineer's office who helped. And everybody in the courthouse.
Yes, thanks everybody.
Next, we have Nick.
I think, is that?
Yeah, that was myself. I just put that down in case. That was,
Matt?
Second.
Okay, that concludes it.
And I would just say that the authority to reconsider after a tie is encompassed in 331-302. There is no statutory prohibition to bringing it back for a board majority. So you are in complete compliance to be able to
I believe I
readdress
got
it.
confirmation from the county attorney before I put that.
So my question, is the county attorney a parliamentarian? And is she an expert on Robert's Rules of Order revised?
I read the state code, Brad.
So do I, Madam County Attorney.
I'll second. All in favor?
Aye.
Opposed?